What kind of treatment is best for sciatica? That's what we're going to cover in today's video. I'm going to go over 5 different things that you need to know about sciatica treatment. Make sure to stick around till the end because I'm going to have 10 different mobility exercises. I'm not going to go through in this video, but there's going to be in the description below. So make sure to stick around for that and I'll give you an idea of how to do that. If you have not been on this channel before, I am Dr. Nate and I created this channel so that I could help people overcome pain, understand it, live well, and get strong because everyone wants to get strong. So let's dive right in. So sciatica is the common term that people know of. Also lumbago, and the technical term for it is radiculopathy. So it's a pain that typically goes down the leg. It can go down to the knee, down the back, it can go down the middle, like in the inside of the leg, and it can also go down the front. So it can be a lot of different things, this radiculopathy. Now, it's really painful and can feel like an electric shock. And if you're watching this, you have probably experienced some of that. It's super frustrating. So these 5 different things that I'm going to share today will give you a better idea of what different treatment options are out there, and we'll go from there. Before I jump into that, one thing that I want to make very clear is that surgery and injections are the last option. Now, if you're having numbness and tingling that's getting worse, if you're having weakness that's getting worse on both sides, and you're having a loss of bowel or bladder function, like it's hard to go pee and poop, then you need to make sure you go and talk to your doctor immediately because that could be a medical emergency. But most people are not going to experience that. Most people will be able to improve with the things I'm going to teach you today. Number 1, specific exercises. So typically there is particular movements, and if you haven't watched my previous videos, there's particular movements that are beneficial, okay? So that people can do and people can't do. So number 1, bending forward, so flexion. So testing if you can bend forward without pain, or does it make your pain the same, better, or worse? The next thing would be trying to bend backwards. So does that make your pain the same, better, or worse? And then going from, sorry, I got some allergies, sniffling like a little sniffler. So the next thing is rotating side to side. And rotating side to side, that is going to, you can see, does that make the pain the same, better, or worse? And then side bending. So all of these, I'll link to another video somewhere around here, and it'll have very specific instructions of how to take yourself through that process. Number 2 is general conditioning. So just finding exercise that you can do that doesn't necessarily aggravate the pain. Now, I'm not saying that you're going to be able to do a lot of exercise pain-free right now. I think a lot of people think they have to be pain-free when they're doing various exercise, but my rule of thumb for all of my patients and clients is that instead of trying to be pain-free all the time, what can we do to make sure that it's not increasing pain levels? So if you can still get a good workout in, whether it's walking, swimming, hiking, lifting, running, and it's just, there's just minimal to moderate discomfort or pain, that's acceptable and it doesn't make it worse. So if you're doing something and it makes it worse, then we want to make sure to hold off on that because it's pretty easy to flare up sciatica. So we do want to hold off on that, but finding different things that you can confidently do that feel good, or decent. Some things don't. So there's usually something that people can do. A lot of people will say, well, I can't do anything. And I have yet to find somebody who can't do anything. So there are lots of different options. And please leave a comment below if you think you've tried everything. So we'll come up with that. Number 3, a really crucial part to the sciatica treatment is understanding. So what do I mean by understanding? Understand that things are likely going to be okay. That the reason that you're hurting is because there's an irritated nerve that is causing some discomfort. So there's a lot of debate, like, is it a pinched down nerve? Is it something that's being like hit on by the bones? Is it being pinched? We don't necessarily know that for certain. It makes sense intuitively that that would be the case, but we don't necessarily know that for certain. What we do know is that it hurts and that something is irritated. And it could be that the sciatic nerve is irritated. It could be that the femoral nerve is irritated. There's a lot of different possibilities, but the reality is that understanding that if you don't have symptoms of worsening neurological deficits, meaning numbness and tingling down to the feet that's getting worse, weakness that's getting worse, and loss of bowel and bladder function that's getting worse. In the absence of those things, typically things will get better. Not all the time, but typically if you follow the prior two examples or the prior two things of specific movements that you can do, and then general condition just getting into better shape. Number 4, and this is something that a lot of people don't recognize, time. Time is a great healer. Not in the sense of I'm just going to lay in my bed and do nothing time, but if you commit to specific exercise and general conditioning and you have an understanding that things can likely improve and you give it time, you're probably going to do really well. A lot of people who deal with sciatic symptoms, it takes a while. Like, some people will recover in a month or so, but some people take a couple months to recover fully, and some longer than that. So before people go the surgery or injection route, I always recommend that they wait like at least 6 months to a year if the pain is, if you can get it to a manageable level. Because there's not really any going back after you've gotten surgery done. Now, there are particular cases that will benefit from a surgical procedure, from like a hemilaminectomy, meaning they take out a portion of the spinal column, just a small part, to release some pressure. Sometimes that will be effective in people who are having like absolutely debilitating severe pain for several months. But that's, again, more of a rare case. So surgery is a great tool, and injections can be a great tool, but it needs to be implemented in the proper way. We shouldn't be jumping to things like that, because that's a last line of defense. Number 5 is that everybody is different. So you might know somebody who dealt with or who suffered with sciatica symptoms, and they got better in 2 weeks, right? And you've been dealing with this for 2 months. Well, that's okay. Like, that's just how things are. Some people will improve super fast. Some people will take longer. Some of it is dependent on what types of exercise and movement you're doing, but I can assure you, without a shadow of a doubt, that if you follow specific movements, finding movements that you can do that make it feel better, you commit to an exercise program that doesn't make your pain worse, and you understand that things take time and it'll get better, most people will improve. Now, I can't say that you will particularly, specifically improve, because I haven't evaluated you, but from my experience and most of the literature that I've read, most people will improve with that. What I don't want to sound like is that I'm just writing it off and like, oh, just give it time. Like, if you just give it time, you don't do anything, then it probably won't get better. And I know that like a lot of the literature, it says immediately, it just says, well, just most back pain improves on its own. And yes, to a certain degree, but that doesn't account for the percentage of people who develop chronic pain chronic pain, and that's a big problem. So I definitely don't want to write any of you guys off saying that, oh, it'll just get better. Like, you have to put the work in for sure. It's not just gonna like magically go away. It takes time, it takes movement, it takes just getting in better shape, and likely you can improve that way. So as a summary, the 5 things are specific movements, so finding things that you can do that don't make it worse but actually make it better or just kind of the same. Number 2, doing general conditioning just to get into better shape. Exercise alone has a great effect on back pain and just other types of pain, and great for our mental health, especially when we're dealing with really severe pain. And number 3, what did I say? Number 3, understanding pain, so understanding that it's not something that's dangerous, it's something that can be addressed with conservative treatment. Number 4 is time, so things just take time. Some people will take longer than others. And then the last thing is number 5, everyone is different. Everyone's different, so everyone's going to recover in a different way. Everyone's going to have a little bit different presentation of symptoms, so you can't necessarily just say, well, this person did this, and I should do the same thing, because everyone's different. And a movement that helps somebody might make you worse. So it's just a matter of finding which movements you can do. You can have a self-directed program to help yourself. So I hope this was helpful. Please comment below. I have a question for you. What have you done so far to try to help with your sciatica, radiculopathy symptoms? Please comment below and I will respond. I'd love to hear what you've done. And as always, please like, subscribe, and I will be posting tons of content over the course of the next couple days, weeks, months, years. So stay tuned, and you'll get a lot more content about this, other conditions, how to work out, how to get strong, how to live well. And thanks for watching. Catch you later.